According to the World Malaria Report, in 2017, there was an estimated of 219 million cases of malaria, and this happened within 87 countries and with 43,500 deaths occurring. Malaria cases are getting simply out of control on the continent of Africa. This is simply unacceptable because we need to prevent the spread of this horrific disease. The involvement of technology on the continent of Africa allows for an optimistic treatment to occur for the disease of malaria. People simply see Africa as a diseased place due to them being unable to find a treatment for this disease. It has been a struggle for many years, and with developing technology, there can be a stop to this horrific disease. So today, I will be speaking on what malaria is, who it affects, ways to treat malaria with specific evolving technology, and why we should care. So first, I will be talking about what malaria is and the specific symptoms and who it targets as the disease. So what is malaria? Malaria is a parasitic disease caused by a Plasmodium parasite. It is primarily transmitted within the bite of an infected mosquito. According to the World Health Organization, the fact sheet about malaria in 2021, malaria is an acute febrile disease caused by Plasmodium parasites, which are spread to people through the bites of infected female Anopheles mosquitoes. So now you may be thinking, what are the symptoms of malaria? According to the World Health Organization, the first symptoms are fever, headache, and chills, which they usually appear between 10 to 15 days after the infected mosquito bite and may be mild, but then they also can be difficult to recognize as malaria as well. So who does this disease specifically target? Specifically targeted are young children and pregnant women are the most vulnerable in high transmission areas or regions that have malaria. According to the World Health Organization, children under the age of 5 years old are the most vulnerable group affected by malaria. In 2019, they accounted for 67% of all malaria deaths, and that is the number of 274,000 deaths that are occurring. The International Journal of Infectious Diseases says the highest burden of severe malaria and malaria mortality is concentrated among young children. However, infection and mild disease continue to pose a burden on adolescents and less in non-pregnant adults. So now that one knows that malaria is a parasitic disease and who it targets, we will be covering who it affects. In general, like every disease has a target. Who does malaria affect is the real question. Malaria affects a wide variety of people because of different types of scenarios. According to the Information and Communication Technology for Development for Africa, the reasons for the death toll on the aforementioned regions are due to convenient tropical climate for the growth of parasites, inadequate technology to combat the disease, illiteracy, and poor socioeconomic places or conditions which make access difficult to health and prevention for it. So essentially, malaria in those types of places are high in risk because they don't have the types of resources to prevent the disease. The continent of Africa is also a place of burden when it comes to malaria. The different sets of data back the burdens up with substantial evidence. The International Journal of Infectious Diseases also states the burden of malaria in sub-Saharan Africa remains challenging to measure, relying on epidemiological modeling to evaluate the impact of investments and providing an in-depth analysis of progress and trends in malaria response globally. The International Journal of Infectious Diseases also states, in malaria endemic countries of Africa, there is an increasing use of routine surveillance data to define national strategic targets. This estimates malaria case burdens and measure control progress to identify financing priorities. Finally, African technology is sufficient due to being an underdeveloped continent. The continent has not been able to provide a technology that works to eliminate malaria as of today. Africa is a place where technology has been lacking the proper resources, and one, however, knows that Africa is a region where the malaria is thriving. Africa is an underdeveloped continent without good resources to prevent the disease. New technology advancements will help Africa beat the terrible disease that has been evading their home for quite some time. So now, technologies have been evolving, and there are now ways to treat this deadly disease. One technology advancement would be the rapid diagnostic tests. According to the Information and Communication Technology for Development of Africa, malaria can be diagnosed using rapid diagnostic tests or through a microscope. So now you're wondering, what are rapid diagnostic tests? RDT is costly, but no special training is used to take an RDT. They are quick and easy tests with fast results, for one, whereas a microscope depends on the user who is viewing the red blood cells through the microscope with their own eye, and they're prone to make mistakes on what they're actually viewing, whether it is malaria in the red blood cells or not. So microscopes aren't always as dependable as RDTs. The Journal of Public Health in Africa states, furthermore, RDT have provided rural health centers with reliable malaria treatments. Malaria diagnostics thereby decreasing excessive and selection for drug resistance. Another technological advancement would be the use of mobile cell phones. The Malaria Journal 9 says cell phones were used to track malaria, and using mobile phones loaded with the follow-up application module. The follow-up module is basically helping with following up with malaria. The journal also states information can be captured on the phone, and that was used for the malaria follow-up data. The Disease and Treatment Monitoring Malaria, or DTMM, is a mobile technology, and it combined both web-based and smartphone applications to manage malaria treatments and care activities. The hope in this is to map disease locations and have active case management, but this is a future outcome of the mobile technology advancement. Mobile technology is beneficial by following malaria transmissions. A third advancement is nanotechnology. Nanotechnology is widely used in malaria treatment. It improves this effective range of the procedure and simultaneously reduces the adverse side effects. Nanotechnology helps in mosquito control and malaria therapy. Nanotechnology also works to control malaria by implementing successful therapeutic approaches to targeting this parasitic directly and eliminating the vector. Vector control is an essential element of malaria elimination and the control strategies of malaria. So nanotechnology is actually the newest technology that is evolving within the continent of Africa. A final advancement would be the drug repositioning. Drugs have been known to resist and be unsuccessful when it comes to fighting malaria. According to the Springer Berlin Heidelberg, the pharmaceutical industry have now acknowledged the central importance of drug repositioning in the discovery of a new active agent. Global research directed at anti-malarial drug discovery has principally focused on the asexual blood stages of malaria parasites. Some anti-cancers are also drug repositioning, and this is such as methotrexate, which are potent against malaria. Anti-cancers can be actually too toxic for the human body, which is why we need to find a perfect dose so then the humans are not harmed, but that we can also be potent against malaria. And so you're wondering, why should we care? Well, there are clinical trials for a vaccine that are on the way. They are currently a case study in phase 3, and they also these clinical trials, if they are successful, they can help advance for future technology for the elimination of malaria. And within this evolving technology, many lives can be saved as well. Like if the malaria is mapped and is contained throughout the use of the technology that is evolving, proper treatment can be performed in the most vulnerable regions and will save lives. So in conclusion, today's speech covered what malaria is, who it affects, the technological advancements in Africa, and why one should care about malaria. So the involvement of technology on the continent of Africa allows for an outcome that is optimistic of the treatment of malaria and will be putting an end to this. So even though the disease may not affect you personally, it is always good to think of those who are actually suffering from this disease. We need to look at the bigger picture and try and help those in need by keeping up with the technological advancements through within the continent of Africa, so then we can save lives and stop this deadly disease from spreading.